Healthcare settings. Government healthcare agencies generally determine programs by a mandate. Official healthcare agencies, or the government ones, are accountable to taxpayers as well as the government. They offer direct healthcare services at times. They monitor the incidence of disease and injury in the community and develop preventive strategies to maintain and improve the health of the public. They ensure food safety, water quality, and protect the public's health and safety from harmful conditions in the environment, from animal-related injuries, and from disease and nuisance hazards through the enforcement of health and safety standards. For example, there is AA Rural Services, Al-Anon Family Headquarters, and the American Foundation for AIDS Research. Voluntary public health care agencies determine their programs by supporter interest. Both types operate at the local, state, federal, and international levels. The local government agency would be your city or county health department. They're funded by local tax money and by subsidies from the state and federal levels of government. They carry out state laws that are mandated concerning community health. They also carry out non-mandated programs such as health promotion programs. Official government agencies on the state level. Every state will have a state health department that is funded by state tax money, and sometimes they do receive money from the federal government. With the federal or national level, this includes the Department of Health and Human Services, DHHS. They're concerned primarily with health, and that is the U.S. Public Health Service. It is funded by federal taxes. The head of the agency is appointed by the President of the United States and advises the President in health matters. It is made up of 8 agencies. These include the Food and Drug Administration, or FDA, Centers for Disease Control and Prevention, or the CDC, National Institutes of Health, NIH, Health Resources and Services Administration, HSA, Substance Abuse and Mental Health Administration, Agency for Healthcare Research and Quality, and Agency for Toxic Substances and Disease Registry, and Indian Health Services. On the international level, we have one that we look at, and this is the World Health Organization, which is an agency of the United Nations located in Geneva. The major objective of WHO is the highest possible level of health for people all over the world. They define health as a state of complete physical, mental, and social well-being, and not merely as the absence of disease or infirmity. WHO is funded through fees that are paid by member nations of the United Nations. Voluntary healthcare agencies' focus of their focus is education and research. Their services are complementary to those that are provided by official health agencies. The Visiting Nurse Association is an example of a voluntary agency. They provide home nursing care for patients that have acute and chronic diseases. They often meet the needs of patients that have specific diseases such as heart disease and certain segments of the population such as the disabled. The care they provide includes health supervision, education, counseling, bedside care, and carrying out the physician's orders. They may visit mothers that have newborn infants or engage in health teaching. They involve the family in the care of their own members. They assist with referrals for clients to other community services. The staff is a Bachelor of Science in Nursing nurse and home health aides. The greatest change in healthcare services have been noted in the area of private healthcare agencies. Their primary emphasis has been on curing disease and illness, but a change in emphasis includes disease prevention and wellness promotion. They also complement and supplement government healthcare agencies. They're owned by corporations that own a chain of healthcare facilities, or they're owned by individuals who practice within the agency. These are proprietary, or other words, for profit. Private health care, family practice physicians deliver primary care, and they refer to specialists if additional services are needed. And private practice nurses are usually advanced practice nurses, so they've got at least a master's level, and they counsel individuals on healthcare issues. Proprietary hospitals, the for-profit hospitals, this type of care is referred to as acute care because patients are more acutely ill and they require more skilled care. The owner of these facilities can be individual, a partnership, or a corporation. Goals of the teaching and research hospitals include treating patients, especially those with a serious or unusual condition, training sites for physicians, nurses, and other health professionals, and research and development of treatments for disease conditions. Public hospitals are going to include places like the Veterans Administration, any facility that is state, county, or municipally owned, and they're operated as nonprofit hospitals. They are hospitals, or they can also be hospitals for people that have serious mental illnesses. And these facilities are still funded by federal, state, or county funds. The ultimate responsibility for the hospital in the voluntary community hospital rests with the Board of Trustees, who is usually chosen from the community's business and professional people, and they serve without any reimbursement. Ambulatory services include outpatient clinics, ambulatory care facilities, which would be like your urgent care centers, and ambulatory surgery centers, the outpatient surgery. They can be in the private sector, where they're hospital outpatient departments. They can be physician group practices or freestanding ambulatory centers. Or they can also be in the public sector, which would be the community health clinics and Indian health services. They manage disease on an ambulatory basis for those that don't require hospitalization. Part of the healthcare facility, they can be part of a healthcare facility, or they can be a freestanding facility. They function by appointment only, and they include specialty areas such as diabetes, neurology, allergies, oncology. The number of specialized clinics depends on the population of the area. These clinics do employ full-time staff. Urgent care centers are, for some individuals, doctor's offices. They provide an alternative to care by a family physician or care offered in a more expensive emergency department. Patients who desire quick service outside of regular office hours also use them. They provide services for walk-in patients and make primary health care available. These are used by people that don't have a family physician. Names of the centers reflect the type of care that's provided: a convenience clinic, a quick care clinic, or urgent care. A one-day surgical care center would perform surgery at a scheduled date and time, but it eliminates the need and monetary charge for being hospitalized overnight. Outpatient surgery services are also provided within an established hospital. Patients are discharged when they've recovered from the anesthesia and they're considered to be in a stable condition. Freestanding outpatient surgery centers provide outpatient surgery as their only service. Approximately 80% of surgical procedures are performed in this type of care setting. Acute care would be the critical access hospitals. These hospitals are certified to receive cost-based reimbursement from Medicare, but it's intended to improve their financial performance and reduce hospital closures. It is critical to obtain critical access hospital status. Current licensure as an acute care hospital in a rural area that is over 35 miles from another hospital or 15 miles in a mountainous or rugged terrain qualify. They have to have acute care beds and swing beds with a maximum of 25 acute care beds and must maintain an average length of stay of 96 hours or less in the acute care beds.